The 7 most important things you should know about diabetes. Forward. Diabetes mellitus is a very common disease in our days, and its consequences and complications can be very serious, to the point that they can seriously limit our state of health and even lead to death. Diabetes Management Channel aims to disseminate relevant information and knowledge about this disease so that the society of the 21st century can face it successfully. Introduction. Diabetes is a chronic condition that is triggered when the body loses its ability to produce enough insulin or use it effectively. Insulin is a hormone that is made in the pancreas and allows the glucose in food to pass into the body's cells, where it is converted into energy for the muscles and tissues to function. In conclusion, the disease occurs when sugar stays in the blood instead of going to the organs properly. It is for this reason that the most common form of diagnosis is by means of a blood evaluation in which the sugar levels in it are monitored. 1. Diabetes is not a death sentence. Diabetes mellitus is not synonymous with death. It is a chronic disease that requires medical treatment, adequate food, and physical activity to delay or prevent the onset of complications. There are many myths about diabetes, especially when diagnosed in young people, who think it is the end of their life and will not be able to do the things they usually did. However, despite the fact that a definitive cure for diabetes is not yet found, there are proven guidelines that improve the living conditions of patients and allow them to lead a normal life with much lower risk of complications. These guidelines are education about the disease, the implementation of healthy eating, physical exercise according to age and health status, compliance with treatments that require medications, and constant monitoring of glucose levels in blood. The implementation of all these guidelines require healthy changes in the patient's lifestyle, which in turn contributes to minimizing the occurrence of complications of the disease, which in reality are those that threaten people's lives. 2. Education is the main way to start managing diabetes. In contrast to what is commonly believed, diabetes is not only caused for bad lifestyle and diet. There is also a hereditary component, and the patient should not feel guilty but seek adequate attention. The first thing we have to understand is that diabetes is not something you have one day and disappears the next. Diabetes, contrary to what many patients think, is a silent disease that develops over time and long before diagnosis. And besides, their first symptoms tend to be imperceptible. Regular medical checkups and monitoring of our lifestyle and diet are fundamental keys in the prevention and treatment of this disease. Before going to the doctor, it is very important to make a checklist in which the patient considers the presence of a member of your family circle who suffers from this disease. The chances of having diabetes in the future increases by 60% in these cases. A sincere evaluation of our eating habits. Do you eat a balanced diet, or is your intake of carbohydrates, fats and sugars high? A sincere diagnosis of the exercise. What is your level of physical activity? Do you have the following symptoms? Fatigue. Sudden weight loss, thirst. Frequent need to urinate. If you have answered one or more of these points in the affirmative, it is recommended that you tell your doctor at the time of the evaluation. 3. A healthier diet is decisive to control the disease. The WHO food recommendations aimed at preventing diabetes are the following: restrict the consumption of saturated fatty acids to less than 10% of total caloric intake and, for risk groups, to less than 7%. Consume sufficient amounts of vegetable food fiber, a minimum of 20 grams per day, through regular consumption of whole grains, legumes, fruits and vegetables. Reducing vigorously the consumption of free sugars to less than 10% of the total caloric intake, and a greater reduction, to 5%, could be even more beneficial for health. In summary, we should encourage the consumption of healthy and natural foods, as well as reduce the consumption of junk foods and sugary drinks. 4. Exercise helps lower blood glucose levels. WHO recommendations on physical activity are intended for different age groups. It is recommended that children and young people between 5 and 17 years of age exercise moderately intense or intense for a minimum of 60 minutes a day. It is recommended that adults between the ages of 18 and 64 exercise moderately intense aerobic exercise, brisk walking, jogging, gardening, for a minimum of 150 minutes throughout the week, or intense aerobic exercise for a minimum of 75 minutes spread over the week, or an equivalent combination of moderate and intense exercise. It is recommended that the elderly have the same amount of physical activity but also incorporate exercises to improve balance and strengthen the muscles to the extent allowed by their physical capacity and circumstances. 5. Medications are an important part of the diabetes management strategy. All patients with type 1 diabetes need insulin to survive. Without it, even for a short time, they can suffer disastrous consequences for their health. In the case of patients with type 2 diabetes mellitus, the use of medications is required only if blood sugar levels have not been normalized by implementing healthy lifestyle changes. In these cases, the availability of at least 3 groups of medicines for the treatment of diabetes is essential: biguanides, sulfonylureas and insulin. Biguanide, metformin, is a type of biguanide and is currently the only biguanide available in the United States. It is often the first oral medication that is prescribed to someone newly diagnosed with diabetes. It has the advantage of not causing low blood sugar levels. Metformin does not cause the pancreas to produce insulin, but it helps your body use insulin better. Metformin can cause side effects such as nausea or diarrhea in some people. Your doctor may prescribe metformin in combination with another oral diabetes medication. Sulfonylureas are the most prescribed diabetes medications. These medications help your pancreas produce insulin. They are cheap and have few side effects. There are 3 types of sulfonylureas: glipizide, glimepiride and glyburide. Side effects may include weight gain and low level of sodium in the blood. Sulfonylureas can be taken alone or with metformin, pioglitazone, a thiazolidine or insulin. If you are allergic to sulfa, you cannot take a sulfonylurea. Insulin in type 2 diabetes: insulin is only indicated when blood sugar levels have failed to normalize with the addition of at least 2 different groups of oral anti-diabetic medications. 6. The monitoring of blood glucose levels is essential to assess the management of the disease. The role of blood glucose control in preventing the onset and progression of complications has been demonstrated in both type 1 and type 2 diabetes. In particular, a strong relationship between intensive glycemic control and diabetic neuropathy and retinopathy has been proven. In most patients, rigorous glycemic control is difficult to achieve and monitor at the level of primary care, so it is necessary to teach the patient to self-control their blood sugar level. The measurement of glycosylated hemoglobin (HbA1c) is the preferred method of monitoring glycemic control in diabetes. One of the advantages of this test is that the patient does not have to be fasting. However, this test is more expensive than glucometry and, therefore, is not generally accessible. If it cannot be done, the determination of fasting glucose or after eating is considered an acceptable substitute. 7. Complications of disease can be avoided by proper diabetes management. When diabetes is not handled properly, complications occur that are harmful to health and endanger life. Above normal glucose, hyperglycemia, can have fatal consequences by causing disorders such as diabetic ketoacidosis in cases of type 1 and 2 diabetes, or hyperosmolar coma in cases of type 2 diabetes. Too low glucose, hypoglycemia, can occur with any type of diabetes and cause seizures and loss of consciousness. It can occur when the person skips one of the meals or does more exercise than usual, or when the dose of the anti-diabetic is too high. Over time, diabetes can cause damage to the heart, blood vessels, eyes, kidneys and nerves, as well as increase the risk of heart disease. This damage can cause blood flow to decrease, which, added to the injury of the nerves, neuropathy of the feet, increases the risk of ulcers and infections in them, and that sooner or later the limb must be amputated. Diabetic retinopathy is an important cause of blindness and the result of prolonged and cumulative damage to the small vessels of the retina. Diabetes is one of the leading causes of kidney failure. Diabetes that is not well controlled during pregnancy can be devastating for the mother and the child, since it greatly increases the risk of fetal death, congenital anomalies, stillbirth, perinatal death, obstetric complications, and maternal morbidity and mortality. Gestational diabetes increases the risk of an unfavorable outcome, both in the mother and the child, during pregnancy, childbirth, and the immediate postnatal period, preeclampsia and eclampsia, excessive size for gestational age, and shoulder dystocia in the child. Did you like this video? If so, please subscribe to our channel so we can send you notifications about our new released videos. Thank you.